Welcome back, Careblazer. In today's video, I want to talk about delirium. Delirium is really important to know about because anybody can get delirium, but it's especially common in people with dementia. And I want to talk to you about what it is and what are the signs that it might be happening. Because if it's happening for your loved one with dementia, it's important that your loved one goes and gets immediate medical help and medical assessment, because if it's left unaddressed, it can lead to further brain damage. So in this video, I'm going to specifically talk about what delirium is, the 3 different types of delirium, who gets delirium, the symptoms of delirium, how delirium is diagnosed, and if you can fully recover from delirium, and what to do if you suspect your loved one might have delirium. But first, before I go into the video, I have a very important announcement to make. If you are watching this video live when it releases on YouTube, which is Sunday, November 15th, today is the very last day you can join my private care course. It's my private program where I share information and private videos I don't make available anywhere else, where I give you access to live question and answer sessions with me so that we can talk about how you can apply the principles of the care course to your caregiving situation. And the doors to that program close tonight at midnight. I can't keep it open forever or ongoing because starting tomorrow, everything gets released, all the materials get released, and you get to work. So I'm very excited. I am already excited for all of the many Careblazers who have already joined. I hope you will be one of the newest members to join. I look forward to getting to know you a bit better and knowing more about your situation. And it all gets started tomorrow. I'm so excited, and I hope to see you there. All right, now let's get back to this week's video on dementia and delirium. What exactly is delirium? Delirium is an increase in confusion and a more difficulty understanding their surroundings that tends to come on quite suddenly and can fluctuate throughout the day, meaning at moments they seem like they're with it and moments they seem like they're not. But the key is that it comes on suddenly with increased confusion. There are 3 different types of delirium. Let's go over what they are and what the symptoms of those are. The first type is called hyperactive delirium. This delirium is the most common. It's the most easily identifiable delirium. And that's because what tends to happen is your loved one becomes more confused, agitated, maybe combative. They might start to have hallucinations, delusions. They might start acting really strange. Even if your loved one already has symptoms like delusions or hallucinations, it feels like everything just went to an increased level. Everything just got so much worse really quickly. The next type of delirium is called hypoactive delirium. This one is more difficult to notice and often goes missed, especially if your loved one's in a hospital or in a care facility. Because in hypoactive delirium, all of a sudden your loved one seems more drowsy, more sluggish, more sleepy. They might seem to be kind of more in a daze. And in this type of delirium, there's not that agitation, that increased behavior, the increased delusions or hallucinations. So in hypoactive delirium, it's not really a problem for staff or for people in the hospital. In many respects, when somebody is delirium with the hypoactive type, they tend not to be a challenge or a problem for the staff, so it's easy for it to totally go unnoticed. But again, there is a sudden shift in just how drowsy or sluggish or sleepy or in a daze your loved one is. And then the third type is a mixed type where the person fluctuates between the hyperactive and hypoactive. Other symptoms of delirium include inability to stay focused on a topic or switch topics, getting stuck on an idea rather than responding to questions or conversation, being easily distracted, being withdrawn with little or no activity or little response to the environment, poor memory, particularly of recent events, not knowing where they are or who you are, difficulty speaking or recalling words, rambling or nonsense speech, trouble understanding speech, difficulty reading or writing, seeing things that don't exist, restlessness, agitation, combative behavior, calling out, moaning, or making other sounds, being quiet and withdrawn, especially in older adults. That's a sign of hypoactive delirium. Having slowed movement, disturbed sleep patterns, reversal of night-day sleep-wake cycle, meaning that they're up all night and sleeping all day, increased anxiety, fear, or paranoia, depression, irritability or anger, a sense of feeling euphoria, apathy or lack of interest in doing anything, rapid and unpredictable mood shifts, personality changes. As you can see, many of those symptoms are the same exact symptoms that people with dementia can have. They're probably symptoms your loved one with dementia already has. The key in determining whether or not it's delirium is that all of a sudden there seems to be either some new symptoms, or all of a sudden there seems to be an increase in how often they're happening or how strong they're happening. That's the key you want to pick up on. Now, who can get delirium? Anybody can get delirium. I can get delirium, you can get delirium, your loved one with dementia can get delirium. People with dementia are more susceptible to getting delirium. They're at higher risk for getting delirium, and it's more difficult to notice that it's happening because, like I already mentioned, the person with dementia may already have many of those symptoms. It just requires more careful observation to realize, okay, this happened all of a sudden, things got worse all of a sudden, this is happening more often, because it would be really easy to just assume the person has transitioned into another stage. Quite possible they have just transitioned into another stage of dementia, but it's also quite possible that they are experiencing a delirium. This is also why it's really important for you to be an advocate for your loved one with dementia. I've worked with many families whose loved one with dementia goes into a hospital for a brief stay or maybe for operation or procedure, and then the healthcare team or the attending providers assume that the difficulties they're seeing in the person are all because of the dementia. I have personally known people who have gone in with dementia, who have gone into the hospital, had some sort of surgery. They were so delirious afterwards that the doctors were talking about them not being able to go live alone. They couldn't drive anymore, all of these things, when maybe they just had a mild dementia, and the family had to pipe up and say, they were driving before they got here. They were living alone successfully before they got here. So it's important to let the healthcare team know that this is a whole new level. I suspect something else might be going on, because that can trigger the healthcare team to then search for what might be causing the increased confusion that everybody is seeing. But when people come in with a diagnosis of dementia and they start showing symptoms of confusion, it's so easy to just assume it's the dementia. So while anybody can get delirium, the ones who are at most risk include people with brain disorders such as dementia, stroke, or Parkinson's disease, previous history of delirium episodes, visual or hearing impairment, and the presence of multiple medical problems. So what exactly causes delirium? There are many different things that can cause delirium, including certain medications, alcohol or drug intoxication, metabolic imbalances, blood sugar imbalances, urinary tract infections, dehydration, effects of anesthesia, malnutrition or dehydration, exposure to toxins or poisons. If you suspect your loved one might have delirium, it's important to take them in to get a workup so that they can see what's going on. Usually when the underlying problem is addressed, the delirium goes away. For example, if your loved one has a urinary tract infection and it's treated successfully, the delirium tends to go away. Now, for people with dementia, the person might not return to their previous level of functioning before the delirium. You might notice they didn't quite make it back to how they were prior to the delirium, versus somebody who's healthy and younger, they might be able to return fully and recover fully back to their previous level of functioning. So for example, if you're a younger healthy person and you undergo some sort of surgery, you're probably going to be a little delirious as you're coming out of the anesthesia, but eventually you're going to return full functioning back to your normal levels of thinking, versus somebody with dementia who might go through a procedure that requires anesthesia. They're going to go through that delirium phase, and you might notice they don't quite make it back to where they were. That's a common experience for people who have dementia and then have delirium. The delirium gets treated. You notice their dementia kind of took a hit in that process. Careblazer, I hope this video helps you in noticing possible signs of delirium. Again, you really want to pay attention to a sudden, abrupt change in their symptoms. And I sure do hope to be working with many of you starting tomorrow inside of the Care course. Careblazer, I'll be back next week with a new video. In the meantime, keep up the great work. Bye.